Dentistry, transforming your health for a lifetime.
Good morning. Welcome to Complete Health with Dr. Mike Rogers. I'm April, your host. Have you ever wondered why tooth decay happens to people who brush their teeth and doesn't happen to those who don't brush? Because brushing and flossing are not the only important things for good oral health. There's a connection between nutrition and dental health. Our mouths affect our body, and our bodies affect our mouths, which is part of the oral systemic link that we discuss here at Complete Health with Dr. Mike Rogers every week. Good morning, Dr. Rogers.
Good morning, April.
What are we going to talk about today?
This month we celebrate Fruits and Veggies Month, and today we will talk about nutrition and how that can affect your dental health. Years ago, Dr. Weston Price, a Cleveland dentist, made the connection that the relationship between nutrition also affects dental health and physical health. We have done a previous show on sugar, how it affects us both dentally and medically, and how it can be hidden in foods we eat by being labeled as other things. If you consume a lot of sugar every day, there are related problems associated with it, such as getting sick multiple times a year, injuries or surgeries not healing properly or as quickly as they should, low energy levels, poor sleeping habits. On today's show, we will be discussing nutrition for a healthy mouth and a healthy body.
Wow, who would have thought nutrition affects all of those things?
Yeah, exactly.
Why is this so important to you, Dr. Rogers?
Well, if we don't take care of our teeth and gums, we risk tooth decay, gum disease, and even bone and tooth loss. The state of our teeth and gums can often be a signal to other systemic problems, meaning throughout the body, including cardiovascular disease, celiac disease, diabetes, sinus infections, rheumatoid arthritis, irritable bowel, gastroesophageal reflux, alcoholism, and much, much more. In fact, many times dentists can sometimes diagnose these conditions before your physician can. If our eyes are the window to our soul, our mouth is the gateway or the windows to our body.
Wow, and the list just goes on and on. Can you explain how nutrition affects dental health?
Your body is a complex machine. Foods you choose and how often you eat them can affect your general health and the health of your teeth and gums as well. If you consume too many sugar-filled sodas, sweetened fruit drinks, and non-nutritious snacks, you could be at risk for tooth decay. Tooth decay is the single most common chronic childhood disease, but the good news is that it's entirely preventable.
Can you elaborate on how tooth decay happens?
Well, tooth decay happens when the bacteria and plaque come in contact with sugar or simple carbohydrates in the mouth. They produce an acid that attack the teeth. The foods that contains these sugars in any kind can contribute to the decay. To control the amounts of sugar you eat, you should read the nutrition facts and the ingredient labels on the foods and beverages, and choose an option that's lowest in sugar. Common sources of sugar in the diet include soft drinks, candies, cookies, pastries. Your physician or a registered dietitian can also provide suggestions for eating a nutritious diet. If your diet lacks certain nutrients, it may be more difficult for your tissues, especially in the mouth, to resist infection. This may also contribute to gum disease. Severe gum disease is a major cause for tooth loss in adults. Many researchers believe that the disease process is faster and potentially more severe in people with poor nutrition.
So, Dr. Rogers, does nutrition only play a role in preventing the formation of plaque or the development of cavities?
Nutrition does not only simply play a role in preventing the formation of plaque and the development of decay, but a balanced diet and good eating habits facilitate remineralization of the tooth structures in the bone, and in addition, promote healing and resistance to infection.
So the nutrition we're talking about today, is that basically for growing children?
Well, no, it's not only for growing children, it's also for teens and adults. And one of the most important groups of people that we look at also is the developing fetus. Although most babies are born without teeth, the teeth are developing in the womb during pregnancy. Since the systemic effects of diet are of the greatest importance when teeth are forming, women who are pregnant should have their diets include protein, vitamins, calcium, phosphorus, all this stuff needed for development and of healthy tooth buds in the growing fetus. The best way to attain this after birth is by breastfeeding, since it is the ideal means of meeting an infant's nutritional requirements and developing the maxilla while avoiding the risk for extensive premature decay.
Can you tell our listeners what a maxilla is?
Well, the maxilla is the upper jaw of our skull, and when a child breastfeeds, they're going to expand that maxilla and grow the arch itself, which opens the airway and helps the baby grow and develop. And we've talked about that in a previous episode or two on growth and development in kids and how that can affect airway, which can relate to bedwetting and other issues, ADHD and such.
So what I'm hearing is we need healthy teeth and gums to eat nutritious foods, and we also need to eat nutritious foods for healthy teeth and gums.
As children, our diets influence how our teeth develop. And once we're grown, with all our teeth in place, what we eat plays a role in maintaining dental health.
Can you elaborate on that a bit?
Well, the foods that we eat or choose to eat can influence how our bodies react. If we eat high sugar or a lot of carbohydrates, it can run us down the path of diabetes. It can also feed the bacteria in our mouth that create inflammation. And this inflammation can relate to periodontal disease. About half Americans over the age of 30 have some form of periodontal disease. As we mature, as we get older, that percentage increases. Gingivitis, or the early forms of periodontal disease, is basically inflammation of the gums, and this is totally reversible just with proper home care, proper maintenance, and getting into dental office and helping you maintain it.
And of course, proper nutrition.
Exactly. As this progresses or is let to progress, and we still feed the bacteria the wrong foods or the inappropriate foods, it's going to lead to periodontal or a more severe periodontal condition, where you actually start to lose bone support, where you lose jawbone, you start to weaken the gums and have gum issues, bleeding gums, bad breath, irritated problems like that, and you can lose the teeth ultimately. So nutrition does play a great source of keeping our gums and bone healthy, and that's where we're going today.
You are listening to Complete Health with Dr. Mike Rogers. When we come back, we will discuss specific nutrition recommendations.
Complete Health Dentistry.
Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our number one focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry. Transforming your health for a lifetime.
Visit us on the web at Complete Health Dentistry of NEPA.com.
Welcome back to Complete Health with Dr. Mike Rogers. I know it's no fun passing up sugary treats like candies and cookies, but when it comes to tooth decay, food choices play an important role. Some foods can harm your teeth, while others contain essential nutrients to keep them healthy and strong. Dr. Rogers, To help prevent tooth decay, are there food choices to keep in mind?
Yes, foods that prevent tooth decay and minimize cavities naturally are calcium-rich foods, that contain a lot of fiber, fruits, veggies, whole grain foods, and protein-rich foods. And what I'd like to do is go into a little more detail on these 4 headings.
Okay.
Calcium is a prime ingredient in preventing decay and increasing the strength of the bones in our teeth, especially in growing children. And a great source of calcium for us is green leafy vegetables, along with broccoli, bok choy, almonds, Brazil nuts. Sesame seeds are also a great source.
I would never thought of sesame seeds.
Correct. Calcium also, everybody knows calcium in dairy products, cheeses, yogurt, things like that. The thing is the calcium isn't hiding in the fat content. It's actually in. So skim and low-fat options of dairy products are also just as well.
Oh, that's great.
Exactly. Eating high-fiber foods will keep your saliva flowing, and the saliva, as that produced, will flush away plaque. It will flush away bacteria, so decreasing the amount of bacteria that are in association with your teeth.
So when you're talking about high fiber, you're talking about the fruits and vegetables.
Correct. And things that are high fiber, fruits and veggie-wise, Brussels sprouts, peas, cranberries, blueberries, raspberries, red cabbage, oranges, apples, bananas, figs, raisins, all of these things are great. Even in a dried form, such as raisins and cranberries.
Aren't the dried fruits high in sugar?
Well, yes, they are. They do have a higher level of fructose. But one of the things that we are dealing with is if you're eating fruits with fiber, then the fiber itself takes longer for our body to digest. The sugars we're talking about here is fructose. So as it takes longer for our body to digest the fiber, our bodies are absorbing that sugar over a longer period of time. Also, it helps feed the gut bacteria that will break down these sugars in our body and help our body deal with them in a much slower, better way.
How are whole grains and protein-rich foods good for proper nutrition?
Whole grains provide vitamin B and iron, which help keep gums healthy. Whole grains have magnesium, an important part in bones and teeth. And in addition, whole grains are high in fiber. Look for foods such as bran, brown rice, whole grain cereals, pasta. These are all good sources for this. And then protein-rich foods. The body requires proteins to rebuild and repair worn-out tissues. Protein also contains high levels of phosphorus, which is a vital nutrient or a vital component in improving the strength of both your teeth and jaws. It also helps balance the pH in our mouth, and as we talked about, the lower the pH or the more acidic, the greater the likelihood of decay. So areas that have this are green leafy vegetables, nuts are good sources of it. Meat, eggs, tofu are all good sources of protein.
Doctor, I want to back up just a little bit. You had mentioned raisins and craisins and all the dried fruit. Can you talk a little bit more about that? Because I know the dried fruit is known for its heavy sugar content. So how is that good for us?
Well, there's just, if you took a raisin, which is a dehydrated or a dried grape, and you took the same amount of raisins as you would, say, in the same amount of grapes, you're going to get the same amount of sugar. The thing is, when we eat grapes, we may eat a cup of grapes and only get a dozen grapes or a half a dozen grapes. But if we eat a cup of raisins, you're going to get a lot more. So it's increasing the sugar that we're taking because the item per unit is smaller. So that's where it's elevating our blood sugar and compromising our health.
So visually, doctor, one grape is equivalent to, say, 10 or 15 raisins, but the 10 or 15 raisins each have as much sugar as one grape.
Correct. Correct.
So I know you recommended several nutrients that are found in the foods that you recommended, but why are nutrients so important to dental and overall health?
Well, the cells in our mouth, called mucosal cells, turn over in 3 to 7 days. So nutrients shortfalls or excesses will show up in mouth tissues before they show up anywhere else. Periodontal disease, gum disease, where we talked about before, which is the breakdown of the bone and the gum supporting the teeth, is associated also with lower blood levels of vitamins and minerals. And getting enough of the specific nutrients can be important in successful treatment of periodontal disease.
So what nutrients do you need for healthy teeth and gums?
Along with calcium and protein and what we've talked already, I recommend iron. Iron deficiency can cause your tongue to become inflamed. It can create sores inside your mouth. Iron is found in many foods such as dark green leafy vegetables, broccoli, beans and lentils, liver, red meat, bran, and even dark chocolate.
There is some light there.
Yeah, but it's got to be very high, 80% or better, dark chocolate, with no added sugar. Vitamin C is also needed. Too little vitamin C can lead to bleeding gums and loose teeth. There was a term years ago called scurvy that pirates used to get, and that's what it was. Is they had the lack of vitamin C, and vitamin C we know can be found in citrus fruits. It can also be found in sweet potatoes, raw red peppers, and oranges. Another vitamin is the B vitamins. Lack of B3, B12, or B2 can cause bad breath, canker sores, and other mouth sores. To boost your B levels, eat spinach, green leafy vegetables, almonds. Other sources are going to be found in foods like fish, chicken, meat, liver, pork. B2 can be found in pasta and bagels even. Vitamin D, which is the sunshine vitamin, helps our body absorb the calcium. A diet low in vitamin D can cause burning mouth syndrome, which is a burning sensation, or patients have described it as almost like a metallic or a bitter taste in their mouth, as well as increases the likelihood of dry mouth. I recommend for vitamin D, drink milk, eat egg yolks, and fish. And one of the vegetables, if you consider it that, is mushrooms.
Your favorite.
My favorite. Starting to eat them. But so that is a source of vitamin D.
Doctor, are there any other minerals you need to keep your teeth and gums healthy?
Yes, there are. There's phosphorus, zinc, antioxidants, folate, vitamin A, omega-3s, CoQ10, arginine, and even fluoride.
That's quite a list.
It is a list.
And where would we find those?
Well, a lot of them come from green leafy vegetables. It also be from beans and legumes. A lot of berries, grapes, fruits contain a lot of this. You can get fluoride in a lot of these fruits as well, and even in water. I also recommend echinacea, garlic, ginger, and ginseng. These plants can help inhibit the growth of the pathologic or the periodontal bacteria.
Okay. Well, a list of nutrients is all well and good, but when you're standing in the grocery aisle, you still need to know what actual food to buy.
Yeah, luckily you don't have to do anything special. If you eat mostly whole foods and eat lots of fruits, vegetables, and lean proteins, lean meats, this will help avoid the problems of not getting enough nutrients. Avoid most processed foods, especially those that are high in simple sugars and carbohydrates. And also take a fish oil if you don't eat fish.
So, doctor, what you're saying is you should eat whole foods first?
Yes. Try to get all the nutrients and minerals and vitamins and everything from the foods that you eat. And the bonus in that is it gives your teeth and gums and bones a workout. So it helps strengthen that as well. Unless you have a deficiency or your physician says you need an added nutrient, then I would try and get it all from your diet.
So the good news is most grocery stores are set up with healthy foods around the outside of the store, and less healthy choices are in the actual aisles. So if you try to shop the perimeter of the grocery store, you will be making healthy choices.
Great idea.
You're listening to Complete Health with Dr. Mike Rogers. When we come back, Dr. Rogers will go over more of his healthy recommendations for proper nutrition and dental health.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers of Complete Health Dentistry of Northeastern PA. We believe your mouth is a gateway to overall health. Complete dental health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Complete Health Dentistry, transforming your health for a lifetime. Complete Health Dentistry.
A whiter, brighter smile looks great on everyone. It not only improves your appearance, whiter teeth can make you look younger, healthier, and more vibrant. It sure complements a golden summer tan, too. And if you have a wedding in the near future, whitening your teeth should be in your plans. Complete Health Dentistry of Northeastern Pennsylvania is offering $100 off in-office whitening or $25 off our take-home whitening. Dr. Michael Rogers welcomes new patients and extends this whitening special to everyone. Call for an appointment today, 253-5000. It's a great way to boost your confidence. And with the special discount this month, now is the perfect time.
Complete Health Dentistry, transforming your health for a lifetime.
Visit us on the web at CompleteHealthDentistry of NEPA.com.
Welcome back to Complete Health with Dr. Mike Rogers. We talked about the importance of proper nutrition during pregnancy and in children and adults, but what about our aging population and oral health?
Great question. Our risk for periodontal disease goes up as we age, but the longer we maintain good oral health, the better our quality of life will be. It's not clear exactly what causes the oral disease with age. Theories include wear and tear on the teeth and gums, medications, financial limitations or changes because people put off going to their dentist for preventive care as much. Other chronic diseases that are associated with oral problems, and even immunological changes. What is clear, though, is taking care of your teeth and gums at every age is very, very important.
Dr. Rogers, what are some of your dental nutrition suggestions for our listeners?
1, adults should limit eating events to 3 times a day with no more than 2 between meal snacks, and should eliminate foods that pack in and create problems such as crackers, chips, and soft candies. For children who need the energy provided by between meal snacks, they should be healthy food choices, low in cavity producing foods such as cheese, raw vegetables, meat roll-ups, fresh fruits. When oral hygiene or brushing and cleaning your teeth does not immediately follow a meal, I suggest ending a meal with either cheese or milk, a chewing gum with xylitol in it, or rinsing with water. Another thing to do would be to stimulate your salivary flow. Include cool, sour, or tart, nutrient-dense foods, and what I mean by that is sugar-free. Increase your water intake and suck on sugar-free or xylitol-containing mints. Incorporate low-fat, calcium-rich foods in your diet, spaced throughout the day. for the best absorption rate. Avoid dehydration. Drink plenty of water, especially if you wear oral appliances such as dentures and partials, because being dehydrated can cause those to ride and pinch more and create sores in the mouth. The other thing, people with braces should drink more water to flush the bacteria and the plaque away from around the brackets there are. Probiotics. Probiotics may help decrease gingivitis and plaque and the bacteria that are associated with it. You can find this in fermented foods such as sauerkraut. And what that can do is suppress the bacteria or the pathogens in our mouth. Another thing is green tea. Green tea contains polyphenols known to help reduce the bacteria and toxic products of the bacteria. It also contains fluoride. So once again, things that will help our teeth and gums. And then also, and lastly, would be when reading food label, don't forget to look at the serving size and multiply that accordingly.
So what I'm hearing is dental health is more important than most people realize, and nutrition plays a huge role in this. Our teeth may be small, but they and our gums are a lot more important to our health than many of us realize. Without teeth, we can't chew. Imagine that. No more crunchy raw vegetables and fruits. No more nuts.
April, did you know people with 25 or more teeth tend to eat more nutritiously? We need healthy teeth and gums to eat nutritious foods, and we need to eat nutritious foods to keep and maintain our healthy teeth and gums. As children, our diet influences how our teeth and overall bodies grow and develop. And once we're grown, with all our teeth in place, what we eat plays a role in maintaining our dental health. Proper diet and nutrition not only improve our lifespan, but more importantly, it improves our health span.
What do you mean by health span?
Well, lifespan is the time from when you start, when you're born, to the time you live. And as most Americans right now, as we hit a plateau, our health span starts to wane long before our lifespan ends. And so what our goal or my goal here is to help people live a long, healthy health span. And what I mean was that the health span stays nice and steady until the very, very end. And then your health span and the lifespan end simultaneously. So you're healthy for a long, long, long time all the way to the end.
What a great idea. I think that's wonderful. You've been listening to Complete Health with Dr. Mike Rogers, where we are transforming your health for a lifetime. For more information on this topic and many others, tune in every Saturday morning at 8 a.m. If you missed a show or want to re-listen, go to our website at CompleteHealthDentistryOfNEPA.com for a link to listen to all of our shows. You can also like our Facebook page at Complete Health Dentistry of NEPA for more information on these topics.
Complete Health Dentistry, transforming your health for a lifetime. Complete Health Dentistry.
As we begin a new sports season, Dr. Mike Rogers of Complete Health Dentistry of NEPA is reminding athletes of all ages of the importance of wearing mouth guards. Mouth guards are used to protect your teeth, gums, lips, and jaw from injury and help redistribute forces from a blow to the head, preventing a lifetime of future dental problems due to broken or knocked out teeth. A mouth guard should be worn even if you wear braces. To support our local sports teams, our office will be holding several mouthguard clinics. You can get a custom-fitted mouthguard for only $45. Just mention this commercial and the sport you play. These mouthguards can be made with your school colors. Call our office for more information and to reserve your time. 570-253-5000.
Complete Health Dentistry, transforming your health for